Hi, my name is Maribel Tapia Ayon, and I will be addressing nurse workload and burnout. Why is this important to me? As hospital leaders, nursing managers, or HR professionals, we all play a vital role in maintaining a healthy, high performing workforce and ensuring high quality patient care. But when nurses are burned out, the ripple effects are felt everywhere. Burnout doesn't just mean a tired nurse, it often leads to reduced engagement and ultimately high turnover rates. While this topic may sound like it primarily concerns nurses, it is truly a shared issue. It impacts financial outcomes, staff morals, and patient safety. The problem: nurses in our facility are managing extremely high patient loads. Our own data shows that 60% of our nurses are caring for 7 or more patients per shift. To put that into perspective, safe staffing guidelines often recommend no more than 4 to 5 patients per nurse. When our nurses are assigned nearly double that number, it's no surprise that they report feeling overwhelmed. Background: burnout among nurses isn't new. It has been a growing concern in healthcare, but the situation took a dramatic turn during the COVID-19 pandemic. Many facilities faced critical staffing shortages, surging patient volumes, and emotionally taxing conditions. Nurses were not only doing more work, but they were doing it under intense pressure, they often without the resources or support they needed. This crisis exposed the weakness in our staffing systems and pushed many experienced nurses to leave the profession altogether. Current situation: research consistently shows that high patient loads leads to nurse burnout and higher turnover rates. Hospitals that have mandated nurse staffing levels report better nurse satisfaction and retention. Our survey results align closely with these findings, confirming that this is a serious issue here as well. Why it matters: when nurses are overworked, the risk of clinical errors increases, which can harm patients. Turnover is costly and disruptive because recruiting and training new staff takes time and resources. Ultimately, both patient safety and hospital operations suffer when nurses are burned out. Our purpose and audience: the goal today is to explore practical solutions to reduce nurse workload and burnout. This presentation is especially relevant to hospital leaders, HR teams, and nursing staff as it impacts retention and patient care quality. Solution number one would be to lower nurse to patient ratios. One of the most effective strategies is to reduce the number of patients assigned to each nurse, ideally to no more than 4 per shift. This can be done by assessing current staffing levels, hiring more nurses, and continuously monitoring workloads. Studies show this reduces burnout and improves care. Solution number two: better managerial support. Improving managerial support through leadership training that focuses on empathy and communication can make a big difference. Also, offering flexible scheduling and allowing yourself scheduling a schedule to open, regular breaks, and limiting overtime can help nurses balance work and life better, improving and reducing stress. Solution number three: delegate non clinical tasks. Another solution is to delegate things such as activities of daily living, toileting our patients, baths, and delivering specimens. Allow our staff to have dedicated support. This frees nurses to focus more on patient care, which lowers stress and burnout. It is important that roles are clearly defined to avoid confusion. Recommendations: a recommendation is to implement all three solutions together: reduce patient loads, improve managerial support, and delegate non clinical duties. Investing in staff hiring, leadership training, and support personnel will lead to better nurse retention and high quality care. Regular monitoring and adjustments will keep these changes effective. In conclusion, nurses face heavy workloads and insufficient support, leading to burnout that jeopardizes patient safety. But clear, evidence backed solutions leadership exist. Leadership must act promptly to implement these strategies and create a healthier, safer work environment for nurses and patients. Thank you.